Hello everyone! Welcome back to another Medicine of the Week session on targeted cancer therapies. Today we'll talk about Olaparib, a cutting-edge medication that uses a unique mechanism to target cancer cells. Olaparib is a poly-ADP ribose polymerase or PARP inhibitor. PARP enzymes play a crucial role in repairing single-strand breaks in DNA. By inhibiting PARP, Olaparib prevents the repair of these breaks, leading to double-strand breaks during DNA replication. In tumors with BRCA1 or BRCA2 mutations, where the homologous recombination repair pathway is already defective, this causes cancer cell death through a process called synthetic lethality. Olaparib is approved for treating certain cancers with BRCA mutations or homologous recombination repair deficiencies. These include ovarian, breast, prostate, and pancreatic cancers. It's often used in advanced or metastatic disease either as a monotherapy or in combination with other treatments. Olaparib is especially effective as maintenance therapy following chemotherapy in ovarian cancer patients with a response to platinum-based treatment. Olaparib is administered orally and absorbed efficiently with peak plasma concentration reached in about 1 to 3 hours. It's metabolized in the liver primarily by the enzyme cytochrome 3A4 and has a half-life of approximately 12 hours, requiring twice daily dosing. Food can slightly alter its absorption, so it's usually taken with or without meals. Like many targeted therapies, Olaparib has specific side effects. Common ones include nausea, fatigue, anemia, and diarrhea. Bone marrow suppression, manifesting as anemia, neutropenia, or thrombocytopenia, is a significant concern, requiring regular monitoring. Rarely, Olaparib may cause myelodysplastic syndrome or acute myeloid leukemia, particularly in patients receiving long-term treatment. Other severe side effects is pneumonitis, manifesting as dyspnea, fever, cough, and wheezing. Closely monitoring of these symptoms is recommended, and if pneumonitis is confirmed, Olaparib treatment should be stopped. Olaparib is metabolized by cytochrome 3A4, so strong inhibitors can increase its levels, leading to toxicity. Conversely, inducers of cytochrome can reduce its effectiveness. Additionally, combining Olaparib with drugs that suppress bone marrow, such as platinum-based chemotherapies, may increase the risk of hematologic toxicity. Always assess the patient's medication list for potential interactions. To summarize, Olaparib is a PARP inhibitor that exploits synthetic lethality in BRCA-mutated cancer cells, targeting ovarian, breast, prostate, and pancreatic cancers. It's taken orally twice daily and metabolized by cytochrome 3A4. Common side effects include nausea, anemia, with rare but serious risk like myelodysplastic syndrome or acute myeloid leukemia. Careful monitoring and managing drug interactions are essential for safe and effective use.